The CDC says coronavirus does not spread easily on surfaces or objects. We talked about this earlier today. Even though it said it does not spread easily, they also did kind of clarify that, it still does kind of spread that way. So just be careful. Joining us on 710 KURV is Katie Jarvis. She is a Dr. Katie Jarvis, healthcare expert and the CEO of Bed Beacon. Dr. Katie, thank you so much for joining us. We appreciate it. Now, of course, this doesn't mean that we can just ignore cleaning surfaces and touch something and then touch our face and be okay, right?
Right. So what they're saying is that the main way that the virus spreads is through respiratory contact, meaning somebody coughing near you. But they still want you to clean surfaces. And it turns out that the harder the surface is, the longer the virus lives on it. So stainless steel, for example, it lives for 2 to 3 days, and metals for 5 days. But on packages, it doesn't last as long. It lasts hours. I know that earlier in the course of coronavirus, the CDC tested mail as they were sending receiving mail from China, and then they tested mail going back and forth in the United States. And they felt like mail is safe for us to receive and to send.
Really?
What about money, Dr. Katie? I haven't heard anybody really bring up.
We wash our money.
There's actually been a story. There's been a story of Zach. Oh my gosh. There's been a story of somebody wanting to decontaminate their money, so they put it in the microwave. So don't be that person. Don't be that person. But what about money?
We wash it in soap and water. But my wife got that from a friend of hers who's a retired anesthesiologist. So she got it from a doctor.
You really
so
wash
there.
your money?
No. Right.
All right, Dr.
Money
Katie.
does exchange a lot of hands.
Speak up.
And so it is possible that money probably does have a lot of coronavirus on it, but you'd have to touch a mucous membrane like your nose or your eyes right after touching money in order to get it that way. I quit sticking dollar bills up my nose, I'll let you know. Well, it's funny. You were talking about how somebody microwaved their money. Actually, heat changes the shape of proteins, and proteins have to be the right shape to get into your cells. So heat does slow down the virus, and they have shown that if you put a face mask out in the heat, it actually kills some of the virus on top of the face mask. So if you do that in between wearing your face mask, you might kill some of that virus. You know how, like, you put your hair on a curling iron and it changes shape? That's because you're heating up your hair. Well, same thing happens with viruses. They have proteins on them, and when you look at the coronavirus, it looks like it's got a bunch of hairs around it. Yeah. That will change the shape of proteins. And I think that's what's happening and why it doesn't do as well in the heat.
But people shouldn't really go over and start ironing their dollar bills or putting them in the microwave. Right? They just don't do that.
Well, hold on. Let's go back to the original topic at hand here, because the CDC is saying now it's not that easy to contract something by touching it and contract the coronavirus that way. How does that process normally work in an ideal situation? And what is the CDC referring to here?
What process?
So the CDC basically tests how this virus is spreading. So they've done a lot of contact tracing. We've heard a lot about that. So they're seeing how it's spreading, and they're saying, most of the time it's spreading by a respiratory contact. So I think that all of us wearing our masks is really slowing the spread of this disease. And then social distancing helps spread the disease too. So they're finding that the cleaning of surfaces is less important, not unimportant, just less important to the spread of the disease. And so they're just categorizing how important each way
when it comes to contracting any virus at all via touching a surface and contaminating yourself with it by putting your hand in your mouth or something, how does that process work? Is it like the moisture in your fingers? When you touch something on a table, it kind of sticks to your hand? Is it kind of like that?
That's true. And then that's why we wash our hands. So soap surrounds it forms a bubble around virus or dirt or anything that we've touched, and that soap will basically wash off with water, and it takes whatever's inside of the bubble of the soap away with it. So that's why washing hands is so important, and using alcohol-based hand sanitizers is so important, is because that actually decreases the spread of it more than cleaning surfaces.
Joining us on 710 KURV is Dr. Katie Jarvis. She's obviously a healthcare expert and the CEO of BedBeacon, talking about how the CDC says that COVID-19 doesn't really spread easily on surfaces or objects. Davey?
If I always thought soap killed bad things on your hands, like murdered them or shot. And then the doctor said, no, it's a surfactant. It slides it away, slips it. It allows it to wash away. Is that about right?
That's true. So soap actually is polar, just like water is. And so it basically surrounds the virus and then just washes it away. Yeah. There are some things that kill a virus. Our immune system is really good at that. We have all kinds of players in our immune system. We have offensive players and we have defensive players in our immune system. And we basically can recruit as many of those players as we want. But we don't know to do that until we recognize there's something abnormal going on. So in this game against trying to beat coronavirus, the earlier our body knows that we need to start working on this, the better. That's why they're trying to create a vaccine. There's been a major development this week with Moderna basically announcing that they made it through the first of 3 phases of the clinical trials for the vaccine.
Well, we had a coronavirus expert on the program yesterday. You weren't listening, I bet. And his name is Dr. Ben Newman, teaches at Texas A&M Texarkana. And one of the last questions was, are we going to get a vaccine soon? He said, there's very promising by the end of the year. He said, there's a very promising study, blah, 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 and maybe by the end of the year. Is that possible?
Is this the one that people are referring to, the Moderna one?
Probably right.
Wow. Yes.
So what they're trying to do is, when you look at that picture of the vaccine, of the virus, there's a big circle with a bunch of hairs on it that look like chia pet hairs.
Yeah.
The Moderna vaccine makes the protein that looks like those little hairs. They're called spike proteins. And what happens with that is that our body then sees a spike protein and says, aha, it's time for me to make something to tag it so that we can remove it. The tags, we have a tag and bag kind of offensive system for our body to keep stuff out of our cells. And it basically, our antibodies are the tags. They tag things that are weird, like viruses. And then we have macrophages that are kind of like Pac-Man cells. And the macrophages go around and eat anything that has an antibody on it or a tag on it, and then take it away. So they'll eat up your virus. So that's good, right? And they're hungry all the time. They'll eat anything that has an antibody on it. So the Moderna vaccine is trying to make just the hairs so that our body can say, oh my gosh, that's weird. Whenever we see the virus, we'll say, oh, I remember that weird thing that I saw before, and I need to tag it and get rid of it. And to have a bunch of those tags or antibodies running around our body at the time we get the virus means we can keep them all out of our cells.
Wow. And hopefully that's what Moderna is doing. Dr. Katie, I'm so sorry we have to cut it here, but hopefully we'll have you on again soon, because I know we have so many more questions. Yeah. So I'll be texting you next week. That is Dr. Katie Jarvis, our guest on News Talk 710 KURV.